Assalamu alaikum wa rahmatullahi wa barakatuhu. Good evening to my brothers, my sisters, my youngsters, and to my Islamic Society of Greenville community here in South Carolina. Alhamdulillah, today we have an extremely special guest, a person that is involved in taking care of the Muslim community back home in St. Louis. Inshallah, I'll give a brief introduction to her. But before I do that, I wanted to speak a little bit about what we're going to be discussing tonight, what the actual webinar is for. And as you probably all read the title, it's for Muslims and mental health. Generally, when you hear those two words together, it doesn't click together, because when you say mental health, it's sort of a stigma or a taboo in the community. If you go and tell your parents that, hey, I'm experiencing some issues, they'll tell you just go read the Quran or go do this or go do that. Oh, why don't you have enough faith, and so on and so forth. And obviously, this is something that generally comes from a lack of understanding of what mental health is, from either being afraid of it or being ignorant of it, and so on and so forth. And so today, inshallah, we have our guest who's going to shed light on what mental health is, why it's important, and just as a means for us to understand ourselves better. The Prophet ﷺ, he used to rely on Allah, but despite that, he would take medicine as well. And so for us, we rely on Allah, we're grateful to Allah, but at the same time, we take advantage of medical sciences, the sciences that relate to mental health, and so on and so forth. And so our guest today, I probably won't be able to introduce her as good as she can introduce herself, but inshallah, I'm going to read over her bio for all of you so you can understand who she is and where she's coming from. Her name is Dima Shabana. She is from St. Louis, Missouri. She currently works as a social worker in an elementary school and holds a master's degree in education and in counseling from the University of Missouri, St. Louis. And she also has a bachelor's degree in psychology. For about 7 years, she's worked in I can't say the word. How do you say psychiatric hospital in a variety of different roles. She's worked with individuals of all ages and all backgrounds who are struggling with different sorts of mental illnesses and diagnosis in hopes of providing relief and help for the future. While completing her graduate degree, Dima also joined fellow counselors and mental health professionals on a panel to discuss suicide assessment and prevention. And as many of you know, just if you watch the news, this year alone, we've had 3 or 4 Muslim suicides. And so it's something that we as a community need to become aware of as well. She also has attended workshops in the Muslim community in North America, where she has spoken about the importance of mental health awareness. Her aspirations and her hopes are to help break the stigma as well as the barriers of communication around mental health in the Muslim and in particular the Middle Eastern communities. So inshallah, that's a long bio, but at the end of the day, the reason why I read the bio is to show you that the person that's speaking to you today is somebody that knows this topic. And so we can benefit from her. And I highly encourage, after the program is over, ask questions. If you have things that, whether somebody says that, hey, don't ask every single thing that's on your mind. And I hope that she'll be happy to answer. I can't say it for her, but inshallah, I hope she'll be happy to answer all your questions, and just make sure that, they're appropriate as well. Jazakumullah khairan. Without further ado, our guest, Sister Dima. Jazakumullah khair.
Jazakallah khair, Imam Hudhaifa. Thank you for having me here. It is a pleasure to be on this platform with you. As Imam Hudhaifa said, I am currently working as a school social worker at an elementary school here in St. Louis, Missouri. I obtained my master's degree in counseling, alhamdulillah, in 2020. In school counseling, I received my certification in K-12 school counseling, alhamdulillah. I also worked in a behavioral health hospital, started out as a nursing assistant on different psych wards, working with patients of all ages, all different mental capacities, mental illnesses, and then worked through with case management and ended up with risk assessments and working with individuals in crisis, suicidal, homicidal, alhamdulillah. That was up until recently. I am very passionate about mental health, and especially in the Muslim world, because the Muslims, something that a lot of us don't know, is that Muslims are pioneers of mental health. Mental health awareness started with Muslims, believe it or not, and we are currently at a place where we don't acknowledge it. We don't, it is very taboo to talk about. It's very shameful to talk about, to get help for. And so I'm hoping with all these talks and bringing awareness to the topic, we could help end the stigma, make it not so taboo, and move forward in healing, because that is definitely what is needed. I did want to give a trigger warning from the very beginning. There will be talk of suicide and it can get heavy. So I would recommend, if you feel like you're just not taking it easily, taking it, well, please get up, take a break, get a drink of water, because that topic can get heavy. And alhamdulillah, with our time, I don't know how deep we'll go, but just a heads up. So as we know, how Muslims view mental health, it's in some areas seen as a punishment from God. It's seen as shameful, and people are believed to be possessed by jinn, by different spirits. We are seen to, the mentally ill are seen as people who have weak iman, low faith. They're disconnected from Allah, which is where the shame comes in. And then that mental health is also a Western concept, that Muslims are immune to it. But if you think about it in the aspect of, as American Muslims, we are living in the West. We live in the same culture, same society. We breathe the same air, eat the same food. We use the same social media. And so we don't have a special cape that protects us from this. Islam is a great resource. Something that we will talk about are protective factors, and religion is one of them. People who do follow a religion are more protected than those who might not follow a religion. So Islam can be a protective factor, but it is not the only, but that does not make us immune. It does not completely protect us from the different environmental factors around us, from the different triggers, also from the biological and genetic factors that may pass mental illness down from generation to generation. So also some fun facts about mental health in the Muslim world. Muslims were at the forefront, as I stated earlier, of mental health. The first psychiatric hospitals and mental health wards were started in the Muslim world. They were opened by Muslims in the 8th century. They went by the name, they were called Madistans, which is a healing hospital. And in these Madistans, they focused on, it was a holistic hospital. They focused on the mind, body, and soul, because they are all connected. And Islam sees the mind, body, and soul as one. And we have to care for all of them. You can't leave one off. You can't focus solely on the soul and leave off the mind and body. You can't focus solely on physical and not focus on the mind and the soul. We have to take care of all three aspects. And so at these Madistans, that's what they focused on. They focused on all three. And also another fun fact, also in the 9th century, a Muslim scholar by the name of Al-Balkhi was the first to discuss the different diseases related to the body and soul. A very interesting fact that I found, and it may be because I'm a mental health nerd, but he was the first to describe OCD. And so the psychiatrist who was reading through this was reading through his writings and saw that he was writing about something called al-waswas, which is OCD and different compulsions. And he wrote it, his wording was word for word, as the word for word that we have in our diagnostic manual for mental health illnesses. So he had the same exact symptoms, and his treatment for it was cognitive behavioral therapy, which is talk therapy. So talk therapy essentially was created by Muslims, subhanAllah. And what breaks my heart is that we are currently in a state where we don't believe in talk therapy, where going and seeking therapy means that we are crazy, where going and seeking therapy brings shame to ourselves, shame to our families. Whereas it was us Muslims who created it and introduced it to the rest of the world. So this just proves that mental health is not a Western concept. We are at the forefront. So what is mental health? Everyone has mental health, not to scare anybody, but just like we have physical health, we have good physical health days and we have bad physical health days. The older you get, the worse it gets, alhamdulillah. So mental health refers to every person's mental well-being, your different emotions, thoughts, feelings, your ability to solve different problems, to cope with your day-to-day life, how you overcome difficulties, your social connections, the status of your different relationships. That all falls under the umbrella of mental health. You can have a bad mental health day without having a mental illness. We all have bad days. We all wake up on the wrong side of the bed, right? And that's okay. We can wake up sad, we can wake up angry, we can wake up frustrated. Our days are not, we're not gonna have all good days and we're not gonna have all bad days. Our days fluctuate. And that's okay. And that doesn't necessarily mean that there's anything wrong. Where the mental illness piece comes in is if these low points start to create dysfunction and dysregulation in your day-to-day life. If you're not able to function anymore, if it changes your sleep, it changes your appetite, if you start feeling hopeless, helpless, worthless, all these things, that's whenever mental illness comes in. But if you're feeling sad, it's okay. If you're feeling angry, it's okay. If you're feeling frustrated, it's okay. Those are healthy emotions. Allah gave us those emotions, and it's absolutely normal. It's actually very healthy for us to feel these emotions, right? Because it's just not sustainable for us to be happy all day, every day. That's just not how life is. And so it's okay to feel sad. It's okay to feel angry. It's okay to feel all these negative emotions. But how are you dealing with them? How are you coping with these emotions? If you're sad, do you freeze for days on end? If you're angry, are you breaking things? Are you yelling? Are you danger to yourself or others? What does it look like? And then that's when if it's not safe, that's when there could be a possibility for a mental illness. And with mental illnesses, there's just a wide spectrum, a wide range. It appears in different symptoms. No, it's not one size fits all. If one person is diagnosed with clinical depression, that can look different from the next person who's diagnosed with clinical depression. So it's not one size fits all. And so with mental health, when we say that we don't have any mental health issues, the mental health umbrella is so broad. For us to say that Muslims don't suffer from mental health issues, we are completely disregarding marital issues. Marital issues are considered mental health issues. And, marital issues are common, especially these days in the Muslim world. Divorce is a mental health issue, which is why we also have premarital counseling, because this is something that we need to address. This is something that needs to be taken care of, and it falls under the mental health umbrella. Stress at work. Are we saying that Muslims just don't work stressful jobs? Work causes anxiety. Work can cause burnout. Work can cause depression. All that falls under the mental health umbrella. Are we saying that Muslims don't suffer from substance use and abuse? They do. As much as we would like to, say that we don't, we do. Do Muslims not suffer from suicide? We do. And on the topic of suicide, again, trigger warning. Before I begin this, suicide is haram. It's prohibited in Islam. And with that, in 2021, a Stanford study published in a medical journal found that roughly 8% of American Muslims had attempted suicide. And we were the American Muslims attempted suicide the most out of any other religion. Whereas the Catholic, we're at 6%, Protestant, we're at 5%, and those of the Jewish faith, we're at 3.6%. And that is alarming. And this is just attempted suicide. Alhamdulillah, suicide completions, we were not the highest, but that is just suicide attempts. And this could be, this is related to increased Islamophobia, community stigma, that if somebody is struggling, they just don't know who to go to. There is nobody to go to, or so they think. So the easiest way is to escape, which is also something that we need to be better at. By ending the stigma, we show people that it's okay to struggle, because it is okay to struggle. This life is full of tests. This life is constantly going to be full of hardships. We need to let people know that we are here to help them. You don't have to be trained to be a support person. You don't have to be trained to be a friend. Just be available. And we need to let people that are struggling know that it's essentially okay to not be okay. We should not be expected to be okay every single day, because life is hard. And especially after COVID, life is a lot harder. And for Muslims, bullying for being Muslim has increased. Again, with the Islamophobia, with the socio-political world, and everything being so against Islam and Muslims, with our parents, most of us, are first generation, second generation Muslims. And so we have our parents that immigrated here, and the intergenerational trauma. So if they had trauma and things that they didn't work through, that gets passed down to us. And so now we have to deal with this trauma. And then it gets passed down to our kids and their kids and their kids. And so that's a lot to deal with. And when you're not taught how to deal with it, it gets pretty heavy. And so with that, I wanted to bring about some warning signs of suicide, because it's very important. And this is not everything, but it's just some things for you to look out for. If for anybody around you, a friend, a family member, a coworker, anyone that you may come about. Warning signs of suicide: if someone talks about it, that's a warning sign. If they talk about killing themselves, feeling like a burden, having no reason to live, if you notice that they're hopeless, helpless, if they talk about feeling worthless, like they feel trapped, these are all things to look out for. Another sign is increased substance use. Substance use, people typically don't start abusing substances unless they're using them to cope. And so increased substance use, they're trying to cope with a mental illness, with life struggles, anything like that. So pay attention to that. If they withdraw from activities, and this could, if they're being isolative, if things that they used to do don't bring them happiness anymore, things like that's a warning sign. Giving away possessions, if they just randomly start giving away their things without necessarily saying why, but giving away prized possessions. With this, I actually have a funny story. Well, it's not, and now it's funny. At the time, they were worried, but I go through phases of just getting rid of all my stuff. I donate, I sell, just give it all away. And last year, alhamdulillah, whenever I was still working at the hospital, I would constantly go into work whenever I was giving away all my stuff, and I would tell my coworkers, I'm selling my bed, I'm selling my furniture, my dresser, I'm selling this, I'm giving this away, I'm giving this away, not thinking, that anyone would think anything of it. But one day I had gone in and said, if you know anybody looking for a bed, if you know anybody looking for this, if you know anybody looking for that, and my coworkers sat me down and they were like, Dima, are you wanting to end your life? Are you wanting to, and again, I'm working with behavioral health and behavioral health members of my team. And so they obviously know the warning signs. And so it didn't even click with me because, I always, every year I go through this phase where I have to give everything away. And so I just thought nothing of it. But to them, it's a warning sign. I just came in randomly, started talking about wanting to give up, sell my bed. So that it made me feel good, actually, knowing that there was somebody who was paying attention, that if God forbid I ever had suicidal thoughts, ever had a plan or anything like that, they would be the ones who would know. And so hopefully we could all learn as a Muslim community and learn these signs and be able to reach out to those who we see struggling. Another warning sign is somebody who may be sleeping too much, too little, eating more, eating less. Changes, those subtle changes could mean a lot more than we may think. And another thing on suicide, just be there. If somebody is acting out of the ordinary, if somebody is visibly struggling, be there and be upfront. One thing they teach us with suicide is don't beat around the bush. If you feel like somebody is having suicidal thoughts, if somebody is struggling and is possibly contemplating ending their life, ask them straight up. Are you thinking about ending your life? Are you wanting to end your life? Is suicide on your mind? Are you self-harming? That is the best way, because in that way they would feel more comfortable talking to you. They would feel that burden lift up off their shoulders. And research has shown that asking a person if they are experiencing suicidal ideation, so having suicidal thoughts, does not increase their chance of completing suicide. It does not plant that seed in their head for them to say, oh, well, maybe now I should, maybe this is a good idea. It does the complete opposite. So be upfront. And it's hard. It's hard because the thought of suicide is hard to even wrap our minds around as it is, but you would much rather have this hard conversation than have to live the rest of your life without this person. I was listening to a podcast not too long ago, Muslim podcast, and the host had a guest on there whose mom had attempted suicide. And just the story, absolutely sad. But one thing that I can't stop thinking about that the daughter had said was the mom was clearly going through depression. And this was at a time whenever mental health was not as, out there as it is now. And it's not as talked about as it is now. But the mom's signs and symptoms were depression, like clinical depression. She should have been on medication. And again, going back to the low, weak iman, she prayed 5 times a day, read her Quran, did her fasts, had her adhkar all day. And she was actually at one point sitting with a sheikh and crying and saying, I love Allah and I don't know why I'm feeling this way. I don't know why this is happening to me. And one of the piece that really has me thinking is at one point, she just slept all day. The mom just slept all day, which is increased sleep is a sign of depression, increased or decreased. And so the mom was sleeping all day, and in the middle of the night would get up, and that's when she would live her life, do her laundry, clean the kitchen, just typical day. And so one night at 2 a.m., she called a friend, not thinking anything of it. She thought, I'm living my life, I'm going to call this friend. And so the friend obviously was asleep and didn't answer. And so the next day, the friend called the daughter, who was a guest on this podcast, and said, you really need to get your mom checked out. She's going crazy. She shouldn't be calling people at 2 a.m., blah, blah, blah. And so the daughter did not tell the mom, but the mom shortly after attempted suicide. And the way the daughter described the hospital, the mom was in the hospital for 2 weeks following this attempt. And the way the mom described the scene in the ICU for 2 weeks, there were no less than 80 people there at a time to check on the mom. And in my mind, all I could think was, if just one person out of those 80 people answered her phone call, if just one person, we don't need 80 people, 1 or 2, if one person had acknowledged her, aside from her family, had acknowledged her needs and had noticed, everybody had noticed that she was experiencing these bizarre behaviors. If one person had reached out to her and listened to her and talked to her and allowed her to call them at 2 a.m. and just lose a few hours of sleep, would she have been in that situation that night? SubhanAllah. We're always quick to jump after the fact whenever we could help prevent it. And suicide is the only mental health issue that's 100% preventable. It's 100% preventable. And it's our duty to make sure that this does not happen. Because when people struggle, when people have mental illness, when people have these issues, the hardest thing for them to do is to reach out. And so it is our duty as Muslims to make sure that they are taken care of. And it's hard. And this is coming from somebody working in the field. And the last thing, I come home from work and the last thing I want to do is talk to any other human. The last thing I want to do is help any other human, but it is our duty. We are put on this world. Allah tells us that we are not a believer if we don't love for our brother what we love for ourselves, right? And we want wellness for ourselves, right? We want afiyah for ourselves. We want to be taken care of. And so then we should want that for somebody else. We should want that for the next person. So, and if we want to be taken care of, then we need to take care of the next person, right? We don't show up after the fact, after the deed has been done. We don't show up then. We show up beforehand and make sure that doesn't happen. Because all it takes is one person. All it takes is one person to reach out and say, hey, I can tell you're not okay. I don't know how to fix this, but I'll find somebody who can. We're not all expected to be mental health experts. We're not all expected to know exactly what to say at every single moment, but there are people that know what to say. There are people that are trained in these particular situations that know what to say and that know how to help. Because those in crisis don't know where to go. They can't make that first step. And so we are here to help. Let's see. And so there are some stories I want to bring in from the days of the Prophet alayhi salam that shows how he also struggled with mental illness. He was not immune. That shows that we are not, if the Prophet himself, alayhi salatu wasalam, was not immune to mental illness or mental health issues, then we are also not immune. After Khadija radiallahu anha passed away, and then the Rasul alayhi salam's uncle Abu Talib passed away, he was so sad. He was suffering from so much grief and sorrow for a whole year. That year was named the year of sorrow, the year of sadness, to show how much he was struggling, how deep his grief was. Grief is a mental health issue. People go to counseling for grief. People go to counseling because they're struggling with sadness. People go to counseling because grief can turn into depression. Grief can turn into different, very serious mental health illnesses. And so for a year, he struggled. And one thing that subhanAllah, I find it so deep is, in this day and age, we tell men, if we see men who are struggling with their emotions, who are struggling with their feelings, who cry, who struggle in any aspect of life, we find it to be weak, right? He's not manly. He needs to be manly. The Rasul alayhi salam, the individual that we all should strive to be like, struggled, and he was a man. He was a man, and he struggled with his feelings. That should be that should be how who we want to be like. Not that we want to be sad, not that we want to grieve, but for him to show us that it is okay, that it is okay to grieve, and it is okay for men to grieve, because he was the greatest of men, and he was not immune to grief, subhanallah. And so he struggled with that. There was also a story of the Rasul alayhi salam. He entered a masjid and saw one of the Ansar, Abu Umama, radiyallahu anhu. He was in the masjid at a time when there was no prayer, nothing going on at the masjid. And the Rasul asked him, what's going on? Why are you at the masjid at a time when, it's not normal to see anybody at the masjid? And so he shared with the Prophet alayhi salam that, I am so overcome with anxiety. I'm so overcome with I'm so nervous. I'm so overcome with debt. I just don't know what to do. And what do you think the Prophet did? Did he sit and shame him and say, this is because you're not praying enough? This is because you're not reading enough Quran. This is because you're not staying up all night and repeating your adhkar. This is because you're not fasting enough. No, he gave him a resource. He gave him a dua, a prayer to protect him from anxiety. And he told him to repeat it in the morning and in the evening. And that dua is, Allahumma inni a'udhu bika min al-hammi wal-hazan, wal-ajzi wal-kasal, wal-bukhli wal-jubn, wa-dala'i ad-dayn, wa ghalbat al-rijal. Oh Allah, I seek refuge in you from anxiety and grief, from inability and laziness, from stinginess and cowardice, and from the burden of debt and oppression of men. He gave him a resource. Just like we're supposed to give people resources, but we do the exact opposite, subhanAllah. He acknowledged, he validated his feelings. By giving him this dua, he validated his feelings. And it's okay to feel this way. You're overcome with debt, you're overcome with anxiety. Here's a dua. And we have that, but we are not using, and we are not using our resources. And it's not to say that salah and Sawm and charity and just giving back to the community and being great Muslims is not going to help. It is. Keep up with your prayers, keep up with your fasts, keep up with your charity. But also, here's a secret. You can go to therapy at the same time. You can take your medication at the same time. You can exercise and eat well and drink your water and make sure you get 6 to 8 hours of sleep every night at the same time. Mind, body, and soul. And we need to make sure that we are taking care of our mind, our body, and our soul. Because if we leave one out, we're not going to be okay. And it's not to say that you only go to therapy or you only focus on your mental health when you're down in the trenches. Go to therapy. It's preventive. It's preventative. Your life does not have to be completely terrible in order for you to go to therapy. Therapy isn't only for when life is rough. You go to therapy to learn how to communicate. You go to therapy to prepare yourself for hardship. So just like whenever we have tests, just like whenever we have an assessment or whatever it may be, we prepare beforehand. Go to therapy to prepare. Read your Quran to prepare. Make your 5 daily prayers in preparation for whatever hardship may come. And we are promised hardships. It's not something out of the ordinary. We are promised to be tested. We are promised hardship. But with hardship, that hardship comes ease, and that ease could be therapy, and that ease could be the gym, and that ease could be your medication, whatever it may be. Just like you take your preventative factors if you're ill, right? You want to in the winter, you want to take your vitamin D, and you take your whatever medication it is to make sure that you don't get sick down the line. This is the same thing. Just because we can't see it doesn't mean it's not there. And it is growing in our communities. And the only shame, whenever it comes to mental health, The only shame there is in the lack of help. There is no shame in not being okay. There is no shame in asking for help. The first step with ending the stigma within ourselves, I would say, is first acknowledging that we're not okay. That's the first step, because we like to believe, especially in this day and age with social media, everybody looks like they're fine, right? Everybody looks like they're living the best life and everybody's happy. And so we look at that and we're like, how come they're okay and I'm not? How come they have the biggest smiles on their faces, but I'm feeling this way, right? None of us are okay. No one is okay, regardless of what our social media say. None of us are okay. So acknowledging the fact that we are not okay, that's the first step to healing. Second step is getting help in whatever capacity that may be. Asking a friend, finding a therapist. But this step is so hard because you have to be vulnerable with yourself and with others. But taking that step means you're on the path to healing, inshallah. And then continuing with whatever treatment it may be. Therapy is not going to continue forever. You won't be in therapy for forever, but you go to therapy to learn the different skills that you would need to be able to function regularly again in your life. One thing I will say, whenever it comes to therapy and finding help, finding a Muslim therapist is hard, but they are out there. And it is extremely helpful to find a Muslim therapist. But if you can't, non-Muslim therapists are trained. They are they should be culturally competent whenever it comes to the different cultures, different religions. And if you do go to a non-Muslim therapist, make sure that you do keep up with, ask any questions to your local imam, your family, anything like that. Again, with local imams, great resource, but they are not adequately trained or licensed for mental health issues. They are a great resource whenever it comes to Islamic anything. But to be trained professionals, they are not the ones to go to whenever it comes to mental health. There is a lot more training. There's so much training whenever it comes to becoming a licensed professional, and for a reason. So find a licensed professional. If you can't find Muslim, find non-Muslim. I will say, self-disclosure, my first experience with therapy was with a non-Muslim gentleman, and I pray for him every day. With his help and the mercy of God, they changed my life forever. And then I also worked with a Muslim therapist, and again, two different completely parts of my life, but she was wonderful as well, subhanAllah. But make sure that they don't steer you away from your religion, from your beliefs. They shouldn't, but make sure you stay steadfast on your deen whenever it comes to that. But there is no shame, absolutely none, whenever it comes to asking for help. It is the strongest thing anybody can do, because one, it's hard. It is so hard. Two, it's showing that you want to get better. You want to heal. It's whenever we push things under the rug. It's whenever we ignore all the issues that we're struggling with. That's when things get worse and worse and worse and worse. And we just bottle things up. And what happens whenever you're continuously bottling and bottling and bottling? That bottle's not going to have any more room eventually, right? So that's not healthy. Allah tells us, that Rasul alayhi salam tells us that Allah sent a cure for every disease. So use that cure. The cure, Allah is the only person that can cure, but we have treatment for mental illnesses. Allah is the only person that can cure us. He's the only one that has the cure, but there is treatment out there, and we need to take advantage of it. Alhamdulillah, from what I see in the younger generations, the younger Muslim generations, it's very, I'm very optimistic, alhamdulillah. But it needs to be talked about. It needs to be talked about in our families. It needs to be talked about in our masajid. You know, the older generations aren't going to take any advice from, you know, Dima in St. Louis, but they will take advice from Imam Hudayfa. They will take advice from any other imam in a masjid. They will take them more seriously than they do me. So this stuff needs to be talked about in masajid. We need to, there is actually a suicide response training that is being done by a Muslim organization through Stanford, that every imam and every masjid should look into, to get people, religious leaders especially, properly trained whenever it comes to suicide response training. We need to continue talking about it. That is the only way to break the stigma. That is the only way to end the taboo. It is the only way to make anybody comfortable talking about this very uncomfortable subject. And it's only uncomfortable because we make it that way. Breaking your arm is not an uncomfortable subject. A'udhu billah, getting cancer, we talk about it freely. Being depressed, off the table. Having anxiety, having borderline personality disorder, schizophrenia, all those things are off the table whenever they are very, very real. And it's not, when Allah gives you something, don't call it, we can't, it just blows my mind how we assume that a person is crazy whenever something is brought to you from Allah, especially if it's genetic, subhanAllah. So that's all I have. If anybody has any questions, and I tend to ramble on, so I hope it made sense for the most part.
Jazakumullah khairan. Let me see if there's any questions. If there's not, I have a bunch of questions, so I'm gonna ask, inshallah, if that's okay.
Yeah, absolutely.
So I don't see any questions yet, inshallah. I guess people will be encouraged in a few moments. But my first question is, you talked about going to a non-Muslim therapist, counselor, a mental health professional. And so generally in the masjid, we have a lot of, you know, psychologists, students that are in training in that sort of field come for like an introduction to Islam. They're not really coming for an introduction to Islam, but they're actually coming to understand Muslims, because you probably know that sometimes you're working with different groups of people, and there are some certain cultural things, certain religious things that they have to sort of understand. So my question is, what things do non-Muslims fail to understand, or what things should they understand about the unique sort of concerns of the Muslim American mental health scene?
The biggest thing, and this is something I forgot to mention, the biggest thing that they that a lot of them tend to not understand is that we are such a collectivistic culture, and they come from an individualistic mindset. Everything is just, I just need to worry about me. I need to be okay. Whereas we come from a culture, again, like I said, you know, how what you wish for your brother, what you wish for yourself is what you should wish for your brother, right? And how, you know, you're not a believer if you go to, if you have a full stomach and your neighbor is hungry. We are taught to worry about our family. We are taught to worry about our neighbors. We are taught to worry about everything else. So the biggest thing I would say is the struggle of understanding how collectivistic we are. And that is also a struggle for I would say American Muslims, is differentiating between how much should it be Allahumma nafsi and just me, versus how much should I give back to the community? How much should I worry about my parents? How much should I worry about my siblings? How much should I worry about my friends? And so that is the biggest struggle, I would say. Alhamdulillah, whenever I had my non-Muslim therapist, he came from a Mexican background, and so they're also collectivistic, so that was easy. But talking to, you know, my coworkers in the field and things like that, it's very hard for them to wrap their mind around why I'm worried so much about my parents, why I stress so much about my family, why I stress so much about my friends, why, you know. And so I would say that's the biggest thing.
Jazakumullah khairan. That's a wonderful answer. Honestly, it's something that I didn't even think of that makes it different from everybody else. But the great answer. I had another question as well. Let me check if anybody asked any other questions. Uh, they're just compliments, no questions on the chat. But um, so, as somebody in the mental health profession, and obviously it's something that a lot of young Muslims are sort of getting into, either as becoming professionals or going to professionals, what would be the most rewarding aspect of your profession? And what would you tell somebody that is sort of aspiring to keep their deen in line, but also study this at the same time?
I'm sorry, the first part was what's the most challenging?
What's the most rewarding aspect of it?
The
I don't want
most
to scare people
rewarding.
away.
Okay, the most rewarding. Helping people. There is so much reward, subhanAllah. Like, I'm just gonna be upfront. Nobody goes into mental health for a paycheck. Nobody goes to mental health for the money, because that's not where it is. But you go into it, the most rewarding thing is helping people. Like through my work at a school, just the smiles on the faces of the children, the smiles on the faces of the families, the parents, knowing that just with just one person you could have possibly made a difference in their lives. No amount of money could compare, right? And essentially that is in the root of our deen, is to help, to give back, to, if you have it, share it. And absolutely, I can't think of any other reason why anybody would want to go into the mental health field other than to help and to take away any pain, no matter how small, to take it away from any individual. And then the next part of your question, you said,
It was sort of like what would you tell somebody that is like, I understand you gave the rewarding aspect, but like, what is something that would appease somebody to want to actually go into this field besides the helping aspect? Like, what is like I guess a personal incentive? Like, what does it do for yourself, I guess?
okay. Well, one thing I can tell you, it's, if anybody is going to this field, just to be aware that it is not easy. It's not an easy field because you are carrying on other people's traumas, you're carrying on other people's emotions, you're carrying on other people's problems. So you're not only dealing with, while at the same time having to deal with your own stuff, right? And so it's not easy. But again, just the reward of the reward of helping. I am a helper. I label myself as a helper. I'm the firstborn child / daughter in an immigrant household. So it was the title was kind of laid on me before, as soon as I was born. And so I like to help. And you go into this field, again, not for the paycheck, not because it's easy, because it's far from it. Like I said, I come home and the last thing I want to do is get on the phone. The last thing I want to do is help anybody. But again, I still have my life and I still have to live it, and I still have to help here at home as well. So it's not easy, but the reward is just knowing that you helped, that you're making a difference in the lives of one human versus however many others that you're touching. And even just by doing this, just by getting on these lives and talking to people and just talking about the connection between our religion and mental health. Because in the beginning, you did say, whenever we put mental health and Muslim or Islam together, it's just kind of like, do they even go together? But you see that we were at the forefront of mental health. Muslims were at the forefront. We essentially brought it to the rest of the world. But again, it's just nobody goes into this because it's easy, because it's not. It's draining. The training is intense. The schooling is intense. But you just make a difference.
Yeah. Even there's a prophetic narration in which the Prophet said, "Khairun nasi anfa'uhum linnas," that the best of all people are those that are beneficial towards other people. And I guess that probably plays somewhat of a role in why somebody would want to be a mental health professional. There was one question on the chat that just came up, what are some good sources for if somebody's looking for a Muslim therapist, counselor, where can they go? Like, what are
Okay.
the options?
So there is a website, psychologytoday.com. You can go on there and find different treatment centers, therapists, psychologists, and you can filter out. What I like about it is that you can filter out what it is that you're looking for. The specific, if you're looking for depression, if you're looking for anxiety, for grief, for premarital counseling, for divorce, whatever it may be, you can filter it out that way. And then you can also filter out by religion.
Wow,
It helps you, and you'll search via your zip code and whatever city you're in. There's also, through Stanford, they have a Muslim psychology lab, and their website is maristan.org, maristan.org, and on there you can find different resources, and they also have a search where you can find in your area Muslim therapists. And if you don't find anything in your area, like in your city, in your direct city, alhamdulillah, the good thing about COVID is that we got telehealth. So you can find a licensed therapist in your state that you can talk to via Zoom or whatever app they use.
That makes it really convenient. I think COVID has sort of kind of taught everybody to use Zoom.
Absolutely.
So there's one final question that I had. As an imam, a lot of times people come to my office, whether it's premarital issues, marital issues. I've even had a kid come in and say that, Sheikh, I want to kill myself, right? Wow. And sometimes, I'm only 26 years old. When I hear that, I'm like, I just got married. I don't know how to respond to you. I just, I can't respond to you. Like, let me connect you to somebody. And a lot of times it's like, why didn't you come to me earlier? Why did you wait 6 or 7 months or 8 months? And a lot of people, they respond and they say, well, I didn't want the community to know. I was like, I don't tell anybody anything. My job is literally to keep your secrets. And so the thing that I'm asking is, how do we tackle the taboo of letting people know that when you talk to somebody, like whether a therapist, counselor, sometimes an imam, that there is confidentiality? How do we explain that to people? Because a lot of people, they're just like, it's my business, I shouldn't talk to anybody about it. And they go on dealing with it until their problems get bigger than they can actually handle, and they still end up coming anyways. Yeah. So what exactly would you recommend that a person do in that situation?
Talk about it. In your Jama'ah khutbahs, talk about mental health, talk about what your role is in the mental health world, what they can come to you for. You're a great resource. Again, I don't know if you're licensed.
No, I'm not licensed.
Okay. You're not licensed, but you're a great resource for premarital, for marital, because you know the Islamic concepts, but you'll have the resources or whatever to send them on to somebody who is licensed and who can help further and on a deeper level. But the way that we can end the taboo and the stigma is by talking about it, by constantly and talking about it in a positive light and not a negative. And also telling people to have a plan, have some sort of, so like at my job, we have on the back of our ID, we have like a safety plan if we start feeling overwhelmed, stressed, whatever it may be. And so I think we all need to have a plan. We need to have a support person that we go to. We need to have, what it is we need. And this is what therapy also helps with. What do you do when you're overwhelmed? What do you do when you're stressed? Who do you go to? Is your local imam your first go-to? That's great. Let them know. Is your best friend, is your mom, is your dad? We're living in such a time right now, especially here in the West, where hyper independence is a huge thing, where we believe that we don't need anybody, that we can take care of ourselves and that we can, we'll figure it out. But with mental health, we won't. A protective factor of mental health, along with religion, which I didn't get to, is having a support system, is making sure that there are people around you. And one of the questions that we would ask in our crisis assessments, in our risk assessments in the hospital is there a reason why you would not kill yourself right now if you were given the chance, if you had the means, if you had the intention, if you had, if you were in a position right now to kill yourself, what is one reason why you wouldn't do it? And the majority of people would say, my mom, my dad, my dog, my cat. It was always a person. So we need to teach people that we need a person, and it's okay to need a support system. You know how they say that, it takes a village to raise a child? Well, it takes you still need a village as you grow up. I'm not ashamed at my old age to say that I still need my mom. She's been out of the country for the past month and a half, and I'm counting down the days until she comes back. I'm not ashamed to say that I, have many therapy sessions with my best friend on my way to work every single morning, because that's what we both need. I'm not ashamed to say that I, the end of every week, I need a break, and I need to see somebody, and I need to talk about my week. And there's no shame in having a support system. There's no shame in talking about our struggles, because we are all struggling. We are all struggling very badly. And what we're looking for is we just want somebody to say, I hear you. I got you. I'm feeling the same way. So we don't feel so isolated, because that's all we felt since COVID is isolation, even though we're not in isolation anymore, but we constantly feel like we are the only one in this situation. We are the only one feeling like this, because nobody else is talking about it. And we just need to talk about it. We need to talk about it in our masajid. We need to talk about it in our schooling. In our families, everywhere. And like I said, no one's going to listen to Dima, but they will listen to Imam Hudayfa. They will listen to any, Imam Jalali here at Dar al-Jalal. They will listen to shuyukh, to imams, because mashallah, you guys have the knowledge. You guys, have such a big impact in the community. And so if we can have these talks starting at the masjid and letting the older generations in our families know that this is real and that this needs to be talked about and combated, then the younger generations will feel better about coming out and asking for help.
Jazakumullah khairan. So that was an excellent answer. One of the things is that a lot of people, they don't understand. And so we did this program so that they'd understand what mental health is. So I really want to thank you for the fact that you gave us an hour of your time. You have a lot of busy things that you're doing, and just like everyone else in the world. And so I'd really like to thank you first and foremost. And anybody that's listening or taking the time to listen, whether now or later, if you have any follow-up questions, extra questions, perhaps you want to reach out to Dima herself, you can email me and I can get you her contact, so on and so forth. And you can have a conversation with her, get the resources that you need. If there's anything that I can answer, obviously I'll try my best. But again, one of the reasons why we have these programs, like we did the premarital workshop, we did the marital workshop. Now, this is the first session of like talking about mental health. We'll have more, inshallah. But again, my job isn't to give all of the lectures and give all of the speeches. It's to reach out to the professionals, those that are in those specific fields, to slowly engage. So if you're liking these programs, make sure that you let me know so we can continue doing these kinds of things, inshallah. But I really want to thank Sister Dima. She did an excellent job, alhamdulillah. And if she has any closing remarks, I'd like her to give her closing remarks, inshallah. Jazakumullah khairan.
Jazakallah khair, Imam. Just thank you. It was a pleasure. It's an honor to be on here. Inshallah, at least one person benefited. That's always my intention, is to just have one person benefit from whatever it is I do. So that is my hope. Jazakallah khair. Please don't hesitate to reach out. Always, at any time, whoever it may be, complete stranger or a friend, I'm always available to help anyone possibly feel better.
Jazakumullah khairan, Sister Dima. Jazakumullah khair to all the viewers. I hope you guys all benefited tonight from this session. Inshallah, the session will be on Facebook, obviously, and then it will be uploaded to my YouTube channel. You can watch it there as well. And like I said, if you need to get into contact with the sister Dima, we can arrange that. You can have conversations with her, inshallah. She's obviously in St. Louis, but obviously with her plethora of knowledge and resources, inshallah, she'll be able to help you in whatever way you might need it. And again, one of the things that she kept on repeating is that mental health is preventative. It's preventative. It's preventative. And so these types of discussions, whether you've gotten to the edge, it's not about being at the edge. It's about making sure you don't get to the edge, right? And so again, let's continue having these conversations. Jazakumullah khairan. Assalamu alaikum wa rahmatullahi wa barakatuhu.